survive with a tracheostomy in the throat? This is a question we get quite frequently here at intensivcarehotline.com, and I've got the answers for you today. My name is Patrick Hutzel from intensivcarehotline.com, and this is another quick tip for families in intensive care. We get this question quite frequently: how can one survive with a tracheostomy in the throat? That probably should be phrased differently, with a tracheostomy in the neck. So if a patient has a tracheostomy in the neck, it means that a tube is placed in the throat and in the neck to help a patient breathe. People can live with a tracheostomy, but it requires proper care with intensive care nurses 24 hours a day. Here are some key things to know about surviving and managing a tracheostomy. Number one, breathing and airway care. Tracheostomy tube keeps the airway open. It must stay clean to prevent infections or blockages. Suctioning might be needed to clear mucus and secretions and help with breathing. Humidified air or humidified oxygen can prevent dryness in the throat. Now, also, what is important to know, a tracheostomy is usually done for two reasons. The first reason is to help weaning someone off a ventilator, and it can also be done because patients can't swallow or they can't clear their airway. So those are the reasons why a tracheostomy is generally speaking done. Next, another question that comes up with this quite frequently is eating and drinking. If a patient is awake and stable, speech therapists may evaluate whether a patient can eat safely or if a patient needs a feeding tube. Sometimes people with tracheostomies can swallow normally with training. That is the exception, not the rule from my experience. Communication. The patient can't talk due to the tracheostomy. The patient might be able to use a speaking valve like a Passy-Muir valve if doctors allow it. Writing, gestures, or an app can help with communication, of course. Also, what can help is the cuff down. Tracheostomy can also help with speaking, but that is only if a patient can swallow and is close to having the tracheostomy removed. Next, infection prevention. Tracheostomy site must be cleaned daily to avoid infections. Watch for redness, swelling, pus, or fever, which could mean an infection. Now, the tracheostomy site must be cleaned daily only by intensive care nurses or by critical care nurses with a minimum of 2 years critical care nursing experience. That is evidence-based. Mobility and recovery. Some people with tracheostomies can go home and live with it if their condition improves, and that can be done with a service like intensive care at home. And I encourage you to find out at intensivcareathome.com. If a tracheostomy is temporary, doctors might remove it when a patient is stronger, right? But there's a process that I've described in other videos around how to remove a tracheostomy. The first thing that needs to be done in a situation like this is weaning off the ventilator, and once that's done, weaning off the tracheostomy. Once again, if that can't be achieved, then you should be looking at intensive care at home, and you can find more information at intensivcareathome.com. Now, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And I can very, very, very confidently say that we have saved many lives for our families in intensive care for our clients. And you can verify that on our testimonial section at intensivcarehotline.com. And you can verify it on our intensivcarehotline.com podcast section, where we have done client interviews. Now, also, when it comes to a tracheostomy, just quickly coming back to today's topic, nebulizers help, regular nebulizers, regular inner tube and inner cannula changes help. But all of that needs to be done by critical care nurses 24 hours a day. Otherwise, the risk of a patient having medical emergency or dying is real, right? So, like I said, we have helped hundreds and hundreds of members and clients over the years to make informed decisions, have peace of mind, control, power, and influence, making sure they make informed decisions so that their loved ones get best care and treatment always. And you can join a growing number of clients and members here at intensivcarehotline.com, making sure your loved one gets best care and treatment. Our advice is absolutely life-changing. Once again, you can verify that on our testimonial section. You can verify it on our intensivcarehotline.com podcast section with our client interviews. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. And I hand-hold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly. When I talk to doctors and nurses directly with you or on your behalf or on a three-way call, or I set you up with the right questions to ask, I will ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care. You can become a member if you go to intensivecarehotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly, in the membership you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership you also have exclusive access to 21 ebooks and 21 videos only for our members, and that will help you to make informed decisions, have peace of mind, control, power and influence, making sure your loved one gets best care and treatment. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show. You will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.